Hi, and welcome to Healthy Living. I am here today with three gentlemen. Very pleased to see you. Tim, Dr. John Perry, Victor.
Yes, ma'am.
Excellent to talk to you all today, and thank you so much for joining us. We really want to talk a little bit about the open heart surgery program that you have, and you made some really interesting points when we were first talking. Tim, I've known you for a while working here, but this is not a new program for Hilton Head Hospital.
That's right. The program has been in existence for over 20 years. Started back with Dr. Castle many years ago. Many of the residents of the island probably will remember him.
I remember him, yes.
And yes, it's a very comprehensive team. Several team members, you know, including Victor.
These two,
right,
yes.
Both of whom work in the operating room also and do various parts of the operation itself. And then the operating room has at any one time 9 or 10 players.
Exactly, if you will.
Yeah.
Let's demystify this a little bit. First of all, I'd like to really do a broad spectrum question, if you will, and that is, what kinds of surgeries do you do? Who needs these kinds of surgeries? And how are we able to have that caliber of surgery team here on the island?
Yeah. Victor, the professor, you want to answer that?
I'd be happy to.
Yes,
sure.
I think in answering this question, it's very helpful to define cardiothoracic surgery.
Okay.
And that's surgery of the heart and the thoracic space, cardiothoracic. And if you look at cardiac surgery itself, probably the bread and butter of what we do here and across the entire U.S. Is coronary artery bypass surgery, or as most people know it, bypass surgery.
Got it.
Yeah, that's the bread and butter, what everybody does. Because of the prevalence of cardiovascular disease across the U.S. and particularly in the Southeast.
Oh, interesting.
Yeah.
A lot of iced tea and...
Absolutely. And then a larger portion of the cardiac portion of cardiothoracic surgery would be valvular heart disease.
All right.
Fixing or repairing different valves within the heart, either because of leaking problems or because it's stenotic or too tight.
Can you give me an example of what someone may have heard of when it comes to the valve?
Yes, ma'am. So again, aortic and mitral valve surgeries is what's most often done. And they may have an aortic valve replacement for aortic stenosis or for aortic insufficiency, or some people know it as aortic regurgitation. And the same process with the mitral valve, though mitral insufficiency is more prevalent than mitral stenosis, but both those things have to do with either leaking or too tight of a valve.
It's really interesting to talk to the three of you. One of the things that we really wanted to emphasize was the collaborative nature of the team that you have. And I think, how does all of that work? When if I am a family member, or it's been advised by my primary care physician to come and see you, what can I expect? What is a typical, not procedure, but protocol, if you will?
I let Tim and Victor and myself, we all work these patients up, but they are probably the front runners in terms of seeing the patients. So Tim may be able to lead you right through from a consultation from the cardiologist to the workup, surgery, follow-up.
Sure, yeah. So we're a small team, but it's nice because you are always going to see one of us three. So that's nice. Familiarity with patient and family members.
Develop a relationship with you.
Exactly.
It helps me feel better.
Yeah, from the very start till the very end, you'll see one of us three. Usually more than one.
So typically what happens, Tim, I go to my primary care doctor, then perhaps a cardiologist is involved, and then it's determined that I may need a little more extensive procedure than what they can do. Is that how that all works?
Yes, typically patients will present with symptoms that suggest a heart problem.
Okay.
Their family doc will do some preliminary evaluation like EKGs, maybe an echocardiogram. If they determine they need a little bit more specialized care, such as from a cardiologist, they get referred to the cardiologist. The cardiologist then continues that workup process. The patients that come to us eventually get a heart catheterization that shows blockages, or an echocardiogram that shows one of the valvular problems Victor spoke about. And once they find those problems, many of them can be handled in the cath lab.
Got it.
If it's something that they can't treat, then we're
Then
the
you're
next.
called.
Right.
You're the next line of defense. We're
That's
going to
right.
take a quick break and come back. Can we resume discussion about cardiothoracic surgery? Stay with us. More to come on Healthy Living.